we're trying to make sure that we get enough help and support in order to have their stories be heard because we're able to change lives for the better through dental care.
All right. So, welcome to the You Are a Lawyer podcast, Samora Legros. You and I went to law school together 10 years ago, more than that, because I graduated in May 2015. All right. So, this is a special episode because we're going to bring in some special guests and also find out how we can help out with the dental fund. Okay.
Hello. Hi, how are you?
Thanks for joining. So, Samora,
It's
do
a
you want to
pleasure.
introduce your guest and explain what we'll be talking about?
Yes, so Jessie Cadet Legros, she's the president of the Max and Thérèse Cadet Dental Fund Inc., which is based out of New York. And we have Geneviève on the left. Geneviève is also another founding member who has actually been living in Haiti for the past 25 years. And she has been administering and operating the dental clinic. We communicate, all of us in tandem, and try to learn the best ways that we can also assist the dental clinic. So, a lot of our job is listening to what Geneviève reports from the ground in Canapé Port-au-Prince, and figuring out how we can assist her with her needs.
Okay, very cool. So I'm not sure if Samora told you, but he and I went to law school together
Yes.
about 10 years ago. And we did chat about the dental fund before, but now I just want to know, how can the podcast help you? How can the audience of law students and lawyers help out with the dental fund?
Okay. Thank you, Carla, for giving us the opportunity to share with your audience the story of FMC Fondation Max Cadet. We started in 1992 after the passing of our father, Max Cadet. And 25 years ago, like Samora said, I returned to Haiti to join the management team of FMC, led by my mom, who passed away 12 years ago. And the project is supported by two sister organizations, one in New York and one in France. And with their contribution, we've been able to give dental care to close to 131,000 people over the years, and using 10 fully equipped dental treatment areas with a staff of 35 people. But through the years, we must say that FMC had to adapt to social, political, and economic downfalls of Haiti. And the first clinic was built under an embargo on Haiti back between 1992 and 1995. And we had some brutal changes of government, the earthquake in 2010 that forced us to relocate to where we are today, because where we were before, when we built the first clinic, it was a church-based organization that my mom founded along with five other women. And when my father passed away, they felt that it was the best place to put the clinic. So we built it on top of a medical clinic that was already there. So it became like a medical complex. And we helped the people of the community, but dental care, it's really left for the more privileged people, because you have mostly private clinics. So when we came with that idea, to have a clinic for the more impoverished people. At the time, a dental exam was about 25 cents, It's just like we were doing something symbolic for just to get people to understand the necessities of dental hygiene, and really educate the population. And we created an awareness program with radio stations, with schools. I mean, we will go everywhere to let people know the importance of dental care. And that really brought a lot of fruits, because after a few years, we were like, 100 patient, 150 patient a day. Sometimes we'll go up to 200. So that really help get the project going and really make us understand the need to expand more. Sometimes you will think that people are too poor to understand about dental care, but what we found was really amazing. And after the earthquake, we were forced to relocate. And luckily for us, we found a place that allowed us to put a better layout of the clinic and divide it into specialties, like services. Like we will have endo treatment, perio treatment. We had a lab. We have dentistry. So that layout help us also to accept more people, even more than we were getting before. And after that, we had the COVID 19 that we had to deal with because, I mean, a dental clinic, when you talk about COVID, everybody said you're going to close down because it's the mouth that you're working. But the worst of it all is the gang invasion now that we are dealing with and forcing a large displacement of the population. And also we had a lot of dentists leaving Haiti through the humanitarian program. So that forced a lot of people to come to us because we were the one who were left.
And to provide support for what Genevieve was saying, I remember when I was younger, I was able to go and visit the actual dental foundation site, which was a building. And after the earthquake, there was ingenuity that was incorporated to create different dental chairs that were placed in shipping containers, which is while they're allowed to continue to provide quality dental care to different patients. There's also a dental van that's on site that has multiple chairs. So it's been a story of perseverance and adaptability despite things that were going on. But as Genevieve had commented, we're still able to see about 100 patients a day, and we know that our impact is very important, especially because right now we have maxillofacial surgeries that are taking place. And maxillofacial surgeries are surgeries on the jaw. For certain patients who've been coming to the clinic, they've had to have major tumors removed out of their mouths, whether it was upper jaw or lower jaw, because some of these procedures can cost 2,500 per jaw, which would be around 5,000 for two. We're doing our best to fundraise and support people who can either afford or not afford that sort of dental care and dental support.
In Port-au-Prince, there is a main hospital where dentists from Miami used to come in every 3 months and perform special surgery on those patients with those tumors. But the fact that gangs have overtaken Haiti and the hospital, recently the government tried to reopen the hospital and people were basically attacked and a journalist was killed. So the foreign dentists who used to come and provide this service to Haitians free of charge are no longer traveling to Haiti. But we were fortunate enough that one of the dentists who was working with us at the clinic was part of that group. Her specialty also was maxillofacial. So she put us in touch with Dr. Jean Gilles, who is the primary maxillofacial specialist in Haiti. And he's the one who now collaborates with us. We have a partnership with him. So when the patients come to us and they are coming from different part of Haiti, it's not just Port-au-Prince because dental service in Haiti is a luxury. So you find people coming from the provinces coming to us for this care. So we were able to partner with Dr. Jean-Gilles, and he comes, he evaluates the patients. After he determines that, after biopsy, to determine that whether the tumor is cancerous or not, they set up a plan of action, which is surgery. So this kind of service was not really one of the objective when we started to give services to the clinic. We had no idea that the project will become so grand to a point where we would now be providing maxillofacial surgery. And so while it's been a challenge, but it's been also very rewarding to see patient able to get those life-changing surgeries. The last patient we did was a woman who's 58 years old. Her tumor is so large that you can barely see the inside of her mouth. But beside the tumor really occupies, I would say, a good 80 to 90% part of her mouth. So as a result of that, she was not able to eat. So by the time she came to us, her hemoglobin was at 6, and the normal hemoglobin for someone, for a female, should be around 11. So here we are. Prior to the surgery, we had to set up care with a primary care physician who now took upon himself to basically give her B12 shots, um, make sure that her hemoglobin will reach a normal level prior to surgery. And we were very happy. About 3 weeks after the primary care saw her, she was indeed ready for surgery. But even then, during the procedure, she almost went into cardiac arrest. But they managed to, save her life. And we are happy to report that she now been able to go home. And
Wow.
those patients here, when they go to the surgery, they cannot eat for about 2 to 3 weeks. So a nasal tube is inserted that goes into their stomach, and they are fed through that tube during that time period, because the introduction of food in a mouth that is trying to really recover from such a major surgery would probably lead to infection. So she has to be fed through tubing, and the patients after the surgery come to the clinic for follow-up testing. And so in essence, this is a project that means a lot to us as a family, because my dad did not go into dentistry to really become rich, but rather serve. And he spent his entire life doing this. Although we live in the capital, he would always go to the countryside and deliver care to the most people living in remote area. And I recall him having to take horses sometimes to get to a remote area to deliver care. So it is in that spirit that we created the project, and we are happy to say that it has lasted 32, going on 33 years. And I know Haiti is often synonymous with chaos, synonymous to nothing works, nothing lasts, but that is not true. Here is a beautiful story started by a family, but then again, the family has become much larger than ours, because we have a team of 35 people working together that really take the project to heart and help the less fortunate. Because dental care is very costly, even for people who live in America, the level of service is of quality. We use sterilization procedures just like you would find here. Every patient, we sanitize the chair each time a patient uses it. So things that often people do not associate with a country like Haiti. So the fact that we were able to lift the standard of service the poor patient, along also with people who have insurance, middle class. We've even had uh, government official come and receive service at our clinic because the level is of quality. And we pride ourselves on being able to do that. But again, it would not have been possible without the support of my older brother who runs the French support group, and they were the one instrumental in raising money after the earthquake to bring a mobile clinic. Although we cannot really go to the school anymore because of insecurity, but we spent years going to school and really providing care to young school children so that you teach them at a very early age to take care of their teeth. But the mobile clinic serve as a stationary clinic, so we are able to have more space to offer care to the people who come and seek service.
Yeah. What is the quality of life like? Like for the woman who had the tumor in her mouth, is she able to work, or do these dental issues impact really their entire lives?
As far as I know, this is not a woman who was working, and she has a son who's extremely dedicated, so who takes to her to all the appointment. And Genevieve was telling me it's pretty amazing to see the level of love and attention that he gives to the mom. And I guess he's the one providing for her. There is also an uncle that reside with them because frankly in Haiti we have a government that does not provide any services to the people. And it's so sad. And more than ever now, the country is so chaotic that they cannot. So the clinic, our clinic, become like a little oasis where Haitians who are suffering with dental care can come and receive services. And I must say, even for your listeners, for people who subscribe and listen to your podcast, I mean, the mouth is the entry point of the body. There are millions of bacteria that reside normally in our mouth, and we need those bacteria to keep the mouth healthy. However, certain bacteria don't belong there, or after procedures, or we have infection, it can lead to complication of the heart or other things. So it's important. And for us, it's not a luxury because often when people think about Haiti, they think of infectious disease. So a lot of the program that was sponsored for Haiti would often deal with infectious disease because people don't feel that the mouth is a priority, even in this country.
Yeah.
So, what we have been able to do for the past 32 years to show people no, the mouth is the entry point of the body. And if the mouth is not healthy, the rest of the body also is not going to be healthy. And I'm going to emphasize this by saying that even when people had HIV AIDS, one of the things that you see, they'll develop candida, a fungus in their mouth, and it will overtake the mouth. And in Haiti, when patients would come to the clinic, and if their mouth was full of candida, this was a sign for us to say, go see a physician, you may be sick. And there are also a lot of patients that benefit not only from dental care, because prior to doing any procedures, we make sure that the person is not diabetic. We make sure that they don't suffer from high blood pressure. So in essence, we become, for many people who are poor, who do not get to see a physician, the only source of initial treatment or medical care that can lead them to discover a more complex issue that may be impacting their health.
Yeah. So you're definitely doing more than just providing the dental care. That's what it sounds
Absolutely.
like.
Yes,
Yeah.
yes, yes.
So how do you raise money for the dental fund? Is it with grants, or can people donate, or what's happening? Scholarships?
There was a time we did receive grant. The focus for many of what we consider underdeveloped countries is infectious disease. So you get more money allocated to vaccination, pediatric care. But once you're talking about dental care, we don't get that much. Our role as the support of the Fondation Max Cadet, the Max and Thérèse Cadet Dental Fund, which is a not-for-profit recognized by the federal government. So we are a 501c3 organization. We are also recognized by New York State. So we raise money through activities. The majority of the fund really come from good soul like yourself who would write us a check of 10, 20, $100. We've gotten a few companies sometimes that have more resources. So it's really word of mouth. We tell people and people send us donation. We do have a website called the cadetdentalfund.com. And we also have an email, cadetdentalfund@gmail.com. And people can go online and they donate through PayPal, or people can write a check, or some people who have access to Zelle also can donate. When we receive donation through Zelle, we do not pay for the service, it's free from one bank to the next. But PayPal just charges a fee, but because we are not for profit, so the fee is minimal as opposed to others. And we also get the money rather quickly. But the most important things that we do, our organization does, is that we seek dental material from physicians. Sometimes a physician is retiring and they will get in touch with us and they donate the entire clinic to us. So we now get a technician, they disassemble, they package, and we send it down to Haiti. So that the clinic does not have to really be too concerned about acquiring major piece of equipment because they would just be too expensive for our budget. So those donations come very, very, very handy to us. Fundraising money is what we get, that we try to get throughout the year, and I'm always begging for money.
Yeah. So, what would like $25, how would that support the clinic? And I'm asking because it's 2025. It's been 10 years since we got out of law school. So, if we give 50 people to donate $25, what does that $25 do for the clinic?
Well, it could certainly allow us, do a screening for people, and if they have a few cavities, we could get the amalgam to fill that cavity. But when you're talking about the major surgeries, that's a different ballgame. You're talking about a few $1000s because, like I said, you have to pre-screen the patient. If they have medical issues, we have to take care of that. Then those procedures are complex. They are done under anesthesia, so the patient has to be in a hospital setting at least overnight. And if they are more complicated, then at least 2 days. And then we have to pay the physician, we have to pay the anesthesiologist. So it gets to be more complex. But you know what? In Haiti, we have a saying, by piti pa di shish, meaning like that. I just said it in Creole. No matter how little you give, that does not mean that you stingy. Every little count, every dollar. And I've even told my nieces and nephews, if you were to put a basket next to your bed, starting January 1, you drop $1 in it every single day. By December 31st, you each one of you will be handing me a basket with $365. And what I myself, although I raise money for my organization, but I also donate, and I subscribe to like a monthly donation. You say, okay, you're going to give $15 a month. They take it out of your credit card. You're not even aware, but at the end of the year, it's a $180 contribution. And while many people may not want to write $180 in December, but if you give it in increment, on a monthly basis, it's the price of a few. maybe two or three coffee cups at Starbucks. So we can ask people to give up their coffee and help somebody, get dental care in Haiti.
Yeah, absolutely. I
Yes.
have a newsletter that goes with the podcast, and I'd love to put an ad in the newsletter and ask people to do a donation. We'll encourage monthly, but definitely ask for at least a single donation. I think people would love
Absolutely.
that.
Yes,
So,
definitely.
And to support that, we do on the website have a different scale where it says tailor your donation. So we know that, $50 can help a child with some preventative care. And as Jesse had mentioned, it can range to having to support somebody for 5,000 because of the maxillofacial surgery. What I found is that a lot of this work is organic. So word of mouth, whether it's talking to people that I know, there are people from Southern University who've supported, people from the Browning School, which was my alma mater, also people from Vanderbilt University. The people that I meet on the bus that I've spoken to when I tell them that, this is the fundraising that I'm doing. Specifically last year, we had a few events where we were able to also connect with the organization because I think that it's not just about fundraising, but when people become educated about what we do, they become inspired to help the cause. So last year, I organized a team, and Jesse was part of that team for a Riverdale run. So we had signed up for a 5K with our local YMCA, and we were able to set up a table, put up our banner, but also have a sign-in sheet, and really show people what we were doing in terms of the maxillofacial surgery, which assisted with getting some live support. So we try to find fun activities that also connect with the general population because public health is the overarching branch, and it just so happens that dental care is very important to our public health. Last year, I also had the opportunity of bringing Genevieve while she was visiting in New York. She was able to have certain meetings, but she came and visited the Browning School and spoke in front of the Upper School Student Council. She also delivered a very nice presentation in French for the 10th grade French class. And we were able to talk to different levels of the administration, students, the librarian, and really have an organic feel to how we're interacting with the community because it becomes way more real when you realize that, hey, I could have teeth issues, So I pay attention to my teeth. I brush my teeth. If somebody loses their tooth or gets a cavity or gets a crown, that's something that all humans experience. So we've been doing our best to just emphasize that Haitian people also deserve that same level of support. You know, we're trying to write our own story as we see that the media can't necessarily present all good stories. And yeah, fundraising has been important. Right now, we've raised a little over 4,000 in our fundraising drive this year, and the goal is to get to 20,000 so that we can continue to provide support for the maxillofacial surgeries, but also have some reserve money to assist the other patients who may need some care. So,
A lot is written about Haiti, and every time you read the news, they tell you that 80 to 85% of Port-au-Prince is overtaken by gangs. But the reality is, you still have people living in the country, so they still need to be cared for. We are very fortunate that the clinic is located in an area called Canapeville that has built a strong resistance against the gang. And so, as a result of that, we are able to keep our doors open and continue to give service to people. So, which is also a wonderful story, which is a good for us because, again, a lot of people turn around and say, well, I hear Haiti is all closed up. No, there are people who are living there. And even if the gang had overtaken the entire country, there would still be people living there that would still be in need of care.
yeah.
So I want people to feel confident that whatever contribution they give is used 100% to provide care. Anytime somebody gives a donation, I send them a thank you letter, and that letter has the EIN number so they can declare it at the end of the year for their taxes. So we are a legal, professional organization. We are small, but boy, we carry the mountains of Haiti. Because
Well,
Haiti is a mountainous country, you know that. Yeah.
yeah. Well, I think this is a really good point and a really good perspective, right? Because this is a legal podcast, but everyone listening has teeth. They know someone with teeth and they know
Right.
how this would impact everything, you know? So I think the audience will really enjoy it. And I'm asking you guys right now, make sure you check out the website. We will put that in the episode notes. I'll also put it up on the YouTube channel as well. And I will make sure I give a donation. And this is a big deal, right? And I think even more so than the fact that it's related to your family, I think it'll be a big deal. I think the audience will really enjoy it and they'll be inspired by hearing about what the Dental Fund has done for the last 33 years.
Okay. Well, I would like to talk about also is that all because of the gang invasion of Port-au-Prince, all universities are closed because they are overtaken by gangs. So, which is the case also for the dental school. So we were approached by the dean since the foundation is the only clinic with that capacity that is still open to help the students finish their curriculum. So since September, the third, fourth, and final year of students from the dental school are being trained now at the clinic. So hopefully they'll be able to complete the cycle of studies and become dentist eventually.
That's
Okay,
amazing.
so yeah. Well, I must say also, see, this is a program that we started in 2006 by taking on the graduate students because they're supposed to give the government 1 year after they graduate. So, and there is a gap, a 3 month gap. They usually spend it at the foundation. And then what we do afterwards when they come back from that 1 year of social service, they come, we sometimes employ them so they work at the clinic. But what we do, we allow them to work full-time for about 2 years, and then we take on new students so that we make sure that the dentists that will be opening their clinic will do it in the best way possible. So we want Haiti to have good trained dentists, and that has been our collaboration with the dental school to make sure that they are in a permanent training. Yeah.
And Kyla, just as a follow up, one thing that we've really incorporated into what we do is also promoting through social media. So we've also, you know, shown images, whether it's on Facebook, Instagram, LinkedIn, just so that we can expand on advocacy.
Have you been posting about the students finishing their last year of dental school on social media and things like that?
That's a good idea,
What I
Kyla.
do is that I transfer I transfer information, Alex, and who takes care of all the media aspect of our work. Also, I prepare a PowerPoint presentation of the surgeries. We've done 15 so far, and we have so many more waiting because of funding. We're not able to do them yet, but we have many more waiting to be operated on. Yes, we do try very much to use social media.
But to your point, Kyla, we've done several article things that we've written, but I'm not sure we've done a piece with the dental school because this started this year, right, Genevieve?
We've been doing it since 2006, but they only come for 3 months before they go work for the government for 1 year. But with the university closing, we've been doing it since September. So
Very
they've
good.
been with us. Yeah. And then the professors come also. It's to end the curriculum. So They have to have the professors there to kind of grade them.
But that gives us a
Yeah.
good idea, Kyla. I think we should do a piece on the student because that's a major contribution. Because otherwise, the student would not be able to complete, their studies. So we
Yeah.
need to do a special on that.
Especially because everyone talks about how young kids don't give back. So I think that'd be an interesting angle.
Hmm.
Yeah.
Yeah, that's also how you get homegrown talent to want to come back. I think for a number of people, they can go through school, they could go through their professions, but it's another level of support and philanthropy when you're able to give back to that same community. So to learn that some of these students may go off into other areas or they may come and work at the clinic, so it's a good culture that we're going to try to support. And a lot of our advocacy has more so been on the patients who need the care. And thank you for highlighting and turning the attention to also talking more about the staff and the people who will be learning, because those students are part of our future.
Yeah.
Another thing that is helpful is that when they come to the clinic, they often work with their professors, because we train a lot of the professors that are teaching at the school right now. Also, dentistry is very expensive. This is not something that anybody can. You cannot start up a practice well after school, and the banks in Haiti don't give loans to help the students get started. So we are basically the organization that is helping them keep their training. They work with us for about 2 or 3 years until they can be on their own and then start their practice or even go and teach at the school, because there is no specialty in Haiti. So what we try to do is to concentrate them on one aspect of dentistry. We can have dentists trained in endodontics, and that's what they practice day in and day out. We have some of them in perio, we have in surgery, we have in the lab. So the school is very interested in the way, on our approach to practice dentistry, because then you have people that are very knowledgeable about that aspect that they are looking for, whether it's endo, whether it's perio, whether it's lab or what have you. So we are basically the only clinic that do that type of concentration on just one field. Yeah, among the chaos that is happening in Haiti, there are some success stories. So I'm happy that we're able to talk about ours, because I consider it as being a success story. Because we hear too much about the bad things, about time that we talk about the positive. And I'm happy to be part of the positive.
Yes. Thank you so much for sharing. I mean, if people didn't share the positive stories, nobody would know about them. So I appreciate it.
Yeah.
Thank you. Thank you so much, Kyla.
Okay. Okay.
Bye bye.
Bye bye.
Bye.
Bye. Thanks for having us.
So, listen, audience, this was a different episode, but actually, it's just part two, right? Because when Samora and I
Yeah.
spoke the first time, he gave us the foundation of the Cadet Dental Fund. And now we are building upon that and bringing in additional board members. So, listen, when you brush your teeth this morning, when you brush your teeth tonight, think about how that is a luxury, how you have the time and foresight to even care about your dental health, and consider donating $25 to the Cadet Dental Fund. Okay, the website is cadet, CADET, dentalfund.com. There are multiple ways that you can donate, and we would definitely appreciate a monthly donation, which is benefiting children and adults in Haiti. Okay, so Samora, how can people contact you or reach out to the organization?
We have the website, and thank you for highlighting that. That's cadetdentalfund.com. We also have an email address, cadetdentalfund@gmail.com, which is where we can receive correspondence. and we could start to coordinate and connect the dots. Also through social media, we have the Max and Thérèse Cadet Dental Fund Inc. We can be found on Facebook. You can also find us on LinkedIn, Instagram, and we do our best to show pictures and also advocate for people. So it's a combination of us showing our staff, but also showing the patients who receive the dental care and whose lives are impacted in a positive way.
Yeah. And how cool is this for you to have this family legacy of advocacy, even in the dental and medical space? That's pretty cool.
It's fun because I'll just admit, in undergrad I thought that I was going on a pre-dental route, and I was actually more on a pre-law route, but I was still able to connect the dots because you always need some sort of advocacy, no matter what you're doing, especially in the healthcare field. Advocacy is important. So, whether it's pulling the facts from a story, which we're used to doing in our cases, and finding solutions that are applicable. And for us, when it comes to maxillofacial surgery, we can put people in contact with maxillofacial surgeons who can help resolve a problem.
Absolutely, absolutely. Well, I'm about to go help my little one brush their teeth, and it's going to remind me that I need to go make a donation. So I really appreciate this. I love the opportunity to discuss all the dynamic and different things that lawyers are doing, right? Because it's all integrated in some way, right? You are a board member of a dental fund on the side. Like how more unique can that be? It's fascinating. So thank you so much for sharing with the audience. I appreciate it.
Thank you for having me, and I look forward to continuing to tell this story.
Yes.